We want to talk about the scramble for COVID testing. You know, it might actually be too rushed for some people. You and your family might just be perhaps getting back from the holidays, or maybe you're about to take off somewhere to ring in the new year. When do you really need to get that COVID test to get the most accurate result? WCNC Charlotte's Hunter Sines has the answer and the warning from health officials as cases surge.
Well, so many people are coming down with COVID-19, and that means more people are being exposed to it daily. Then they're rushing to get a test, either using one of these at-home testing kits or waiting in long lines around town. But doctors say, don't rush.
We've seen the long lines full of frustration and anxiety, plus people losing their patience with at-home tests in high demand.
It's unbelievable. I have checked so many places, and it's just so hard to find.
But health officials say some of those who are rushing to get tested right after exposure should wait.
The recommendation would actually be to wait several days, as many as 5 days, before you actually test for the first time.
That recommendation coming from the CDC. They say fully vaccinated people should get a COVID test 5 to 7 days after their last exposure. Those who are not vaccinated should get a test immediately after exposure, and if they test negative, get a second test 5 to 7 days later or as soon as you get symptoms.
If you went to a gathering on Sunday and got exposed, it's not very helpful to get tested on Monday. You want to wait at least 4 to 5 days before you go get tested to give your body a chance to, if you are going to develop an infection, for it to develop.
If you rush it, you could get a negative test result, but days later be spreading the virus without even knowing it.
What you really want to know is if you have it or not.
Mecklenburg County expects to get a new shipment of these at-home testing kits sometime next week, but they aren't sure just how many they're going to be getting. In the meantime, your best bet is to go and wait in one of those long lines, sadly, at one of the testing sites around town, or check in with your local pharmacist. There could be an open appointment that they have. But the bottom line here, doctors are begging you, do not come to an emergency department at a hospital to get a COVID-19 test. They are just too strained right now to be acting as a testing site in an emergency room. In Elizabeth, Hunter Sines, WCNC Charlotte.